Depression is a very common health problem we come across in day-to-day clinical practice. Can be considered as a silent killer disease where patients often succumb to the extremes of depression in the form of suicide. Many of the patients whom we see in clinical practice often will have symptoms referable to depression, and it so often happens that doctors will not notice that symptoms are secondary to depression. It has been observed that this element of depression is more common in patients who have chronic medical illness like hypertension and diabetes. It has also been appreciated that patients who have depression are more likely to develop this chronic medical illness of depression, of hypertension and diabetes. It is like a bidirectional relationship that exists between this condition of depression and chronic medical illness like hypertension and diabetes. Patients with depression are likely to have faulty living habits, faulty lifestyles that make a patient prone to develop this illness, cardiovascular related illness and diabetes mellitus. And also it has been observed that patients who are suffering from hypertension and diabetes are more likely to have depression in them. And what is more surprising thing is that most often patients who are suffering from diabetes and hypertension who have this who have in them depression are not being diagnosed on a routine basis by the treating physician. If this element of depression is not diagnosed in these patients with chronic medical illness of hypertension and diabetes, it will so happen that patients often will have to seek the help of a doctor for so many unrelated problems. And also it also adds to the financial burden of the patient with so many presenting symptoms and getting themselves subjected to so many unnecessary investigations. So as physicians, we have to be aware of the presence of this element of depression in any patient who is suffering from chronic medical illness. Most often, patients do not present themselves with a diagnosis with symptoms of depression, but the treating physician has to look into these elements of depression in them with patient hearing of their symptoms and looking into their background. So we have to appreciate the fact that it is only the tip of the iceberg. We are seeing patients who are suffering from depression who often come to the hospital with suicidal tendency. But what is to be appreciated by people at large in the society is that there has been a significant proportion of the population who are having this problem of depression, but who have not been able to seek the help of a doctor because of the inhibitions they have for themselves about this diagnosis of depression. So the physicians, the family physicians who are closely associated with the patients in the periphery often have to, when they come for any presenting symptom, they have to see whether their presenting symptoms are secondary to depression in them. Otherwise, their health problem will not be cured unless that element is looked into by the treating doctor. So in this context, on this occasion of World Heart Day, I wish to tell my physician colleagues always to look into this element of depression in the physical illness that they have presented with, because most of the times physicians will not have the patience to look into this element of depression. When a patient comes with diabetes or hypertension, it is often the practice that we treat the illness of diabetes and hypertension and not look into the presence of depression in these patients. So again emphasize the importance of looking into depression in patients who suffer from chronic medical illness and try to put them on suitable antidepressant drugs so that patient will have good quality of life and also indirectly can help them to have a longer lifespan with better quality of life. Thank you.